What's going on, everyone? Happy Tuesday. Hopefully, everyone is doing well, staying safe, healthy, having a great day so far, and of course, most important, testing negative for all of the viruses that can make us sick. It is time now for the Tuesday edition of the Virus Update for Tuesday, October 21st, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there, but not enough information is being spread around to help keep you informed with what's going on with these viruses. Of course, the viruses are constantly spreading around, but the information is not. Want to stay informed with what's going on with the latest news, data, information, looks at wastewater, and I'm talking about news and information from around the world? Yeah, just subscribe down below. Give this video a thumbs up if you like it, hit the notification bell, share this video with anyone you know, and leave your comments down below. Already, we do have just a few news stories today, which brings us to a great opportunity to show you the symptoms of COVID and the symptoms of flu. You'll see. We'll lead right into it. It'll make perfect sense because oftentimes those symptoms are very similar to each other. Then we'll take a look at some daily data, including New York State. There is a change with New York State. It has finally happened. And then we'll take a look at a few wastewater sites. I don't know how many we'll do, but we'll definitely take a look at some wastewater sites. I think I do have a note here with one place that we need to take a look at. So starting off with this, health officials confirm measles case in Las Vegas. Visitor exposures possible at airport. Yes, there has been a case of measles that has made its way through Las Vegas, and as we know, a lot of tourists do make their way through Las Vegas. And yeah, this is a busy area. The Southern Nevada Health District confirmed Monday, October 20th, that a visitor who traveled through Harry Reid International Airport last week tested positive for measles, possibly exposing others. Nevada has not had a confirmed case in a resident since 2018. According to local health officials, nationally measles activity has increased sharply this year. So we'll have to see if this means another jurisdiction gets added to the measles list. All right, measles might be spreading in the community, officials warn. What community might we be talking about? Well, in this case, New Zealand is reporting that measles might be spreading after 4 people, including 2 children, have been confirmed to test positive with measles. I believe we talked about this recently, but it's good to bring it up again. I wanted this to go hand in hand with the weekly New Zealand update for COVID, but did not see that this week, and I did not see Dennis put it out, and I went to New Zealand's website, and I was seeing dates from well over a week ago, so doesn't look like there's any update from New Zealand just yet. All right, coming back here to the United States now. Colorado is now testing for measles in wastewater. We've been able to see it in 1 or 2 wastewater sites there on Wastewater Scan, but yes, they are testing for measles, and this is good to see that more and more places are starting to do this. I wish all states had wastewater programs because, let's face it, there are a lot of gaps in the data when it comes to wastewater, and that's not a good thing. We need more places to have wastewater, not just for COVID, influenza, but as you see here, measles as well. It just needs to happen. All right, moving to Richmond, Virginia. The Virginia Department of Wildlife Resources, DWR, has received reports of groups of black vultures across the state, dead black vultures across the state, with preliminary testing indicating that the likely cause is the highly pathogenic avian influenza, also called bird flu. So, yes, bird flu is starting to spread in Virginia once again. We've seen several different cases pop up there, and here we are again. We see yet another case in Virginia. Now moving on to the PMC COVID update from Mike Horger. This is for up to October 20th, and I gotta express caution. Remember, we're still in a government shutdown here in the United States. If you're new to my channel and you're not from the United States, it's the first time you clicked on to one of my videos, the United States has essentially been shut down for multiple weeks now, with no end in sight for the government shutdown. Some who know people in the government are telling me personally this may go on through November. Well, the point being made here is if we're shut down, we're not getting the data, and we're getting hardly anything from the CDC. We may get a measles update this week. I didn't even check. Did we get a measles update today, or is it tomorrow? I don't know, but we're not getting COVID updates right now. So anything we get is very limited in terms of data, or it's on a state level and not federal level. So here's the update from Mike Horger. SARS-CoV-2 transmission has fallen. This is good. Wow, this is actually really good. 1 in 191, 0.5% actively infectious. That is law. Levels at 20% of the summer peak. 255,000 new daily infections. Still concerning, but that is down significantly. If you were following along about a month ago, we were near 1 million cases, and at one point, I think it was Labor Day weekend, we did go over 1 million cases in a day of COVID in the United States. Many will knock out higher risk activities the next 2 to 4 weeks. So we're still good, but I'm generally concerned about post Halloween, and not so much for COVID. I think the next COVID wave really starts kicking in post Thanksgiving, but RSV, flu, and some of those other viruses, they may start their presence. They may start to show up more in wastewater post Halloween. Of course, we'll be tracking it here on the channel. All right, back to his report. PMC COVID update on October 20th. The law transmission remains dangerous. Hey, we're still dealing with an estimated 1.8 million new weekly infections. That's a lot. And 90,000 estimated new long COVID infections, and still 500 excess deaths will result from this week's infections. And speaking of deaths, we've been seeing a ton of young age celebrities or celebrity connection deaths lately. I've been getting messages about them. I've been seeing them on X. It's happening. I don't know how many can actually be linked back to, hey, they had COVID, but there's far too many people who are younger aged and dying at this point. All right. Exposure risk during lulls. Transmission remains high when engaging in many social interactions. So, when you're going to events, which I'm going to be very honest with you about something. Wasn't going to announce this, but I will say this. I'm going to something, when is it? On November 1st. Don't worry. Data report will be masked. And when you take a look here at the number of people it takes for chances for infection. So if there's one person in a room right now in the United States, 0.5%. Let's go up to 10 people, 5.1%. 25, that's 12.3%. 100, that's 40.8%. And the maximum number of people that could be at the event I'm going to is 100 people. As of right now, I keep checking. It's a show. It's a very small show, but it's got high ceilings, it's got good ventilation. I've done my research, is the point. And as of right now, it's only going to be 80. It's not sold out. We'll see. Is that going to remain that way? I don't know. But then once you start getting to the bigger events, 200, 300, yeah, take a look at that. 300 people, 79.2%, and 100 people is 40.8%. My hope is that number will be even lower. But again, I often tell you this, don't always follow the national level. Follow your local region, your state, your community. I mean, here we are, 100 people equals 40.8% chance of infection. That could be a completely different number in your local community. If wastewater is rising in your community for COVID, well, then that percent chance at 100 people, yeah, it would be even higher, which is not a good thing. Moving on now to the forecast, and the forecast shows this law is going to continue, and right around that Saturday, November 1st, you can see here, it does go up just a little bit at that point, but for overall, we're still dropping. That drop will slow a little bit, so we'll have to see what happens. Alrighty, moving on now to this. Basketball. Jazz's Ace Bailey, let's refresh this, or maybe we don't need to refresh this, is dealing with an illness, and as you know, or maybe you don't know, a lot of NBA teams this week get their season started. Matter of fact, I think all do. My team, the Sixers, their first game will be tomorrow night. I do intend to potentially watch that tomorrow night. And in this case, they're dealing with the flu. So it dawned on me, I was thinking, we're talking about a Clippers player dealing with the flu, and I thought, you know what? Let's go over the symptoms of flu and COVID. Let's just spend like 1 or 2 minutes on this, because you'll be surprised. The symptoms can be very similar, and this is why those multi-tests, which are now available in the United States, the multi-virus tests, are oh so important. Because you may take a test for COVID, oh, it's negative, or take a test for flu, oh, it's negative. But maybe you have one of the other viruses, so if you take a test that has multiple viruses listed on it, you can see, is it flu, is it COVID, HMPV, norovirus. I don't know. There's various different things that can be tracked on those tests. So starting off with the symptoms of flu first, which again, it's going to sound a lot like COVID. Symptoms of flu can cause mild to severe illness and at times can lead to death. Well, COVID can too. Flu symptoms usually come on suddenly. People who have flu often feel some or all of these signs and symptoms coming on suddenly. Hey, that's kind of what happened to me with COVID, although prior to that, I was sick with some mystery virus. I still don't know what that was. And then all of a sudden that got better, and then scratchy throat came back, and then all of a sudden that night, I was feeling god awful. Fever or feeling feverish and chills can also be like COVID. Cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, tiredness. Some people may have vomiting and diarrhea, though this is more common in children and adults. Now, let's go over to COVID. And there is one big thing that is different with COVID. Yes, we know there is now, quote, long flu, but long COVID is a much bigger deal. And that is one thing that really sets COVID apart, is the long-term impact that millions of people, including children, are dealing with. So here we go. The signs and symptoms of COVID: fever or chills, cough, shortness of breath, difficulty breathing, sore throat, congestion or runny nose, new loss of taste or smell, fatigue, muscle or body aches, headaches, nausea or vomiting, diarrhea. And you notice here, they're not saying it's sometimes. No, they're saying it can happen. And a lot of these, I did deal with the vomiting. Yeah, I dealt with that during COVID. I was coughing so darn much that whatever liquids I had there, I went, yeah, it wasn't very pleasant. CDC will continue to update this list now. We know there can be many other different symptoms: dizziness, headaches. There's just a whole array of things. You can get a bunch of weird things that can happen too. It can impact your hearing. Your eyesight may get blurry because you're dizzy. I mean, all these various different things can happen. And of course, if it starts to turn serious when it comes trouble for breathing, persistent pain, pressure, confusion, inability to stay awake, all these other things, you may want to seek some medical attention. Start off by calling your doctor, and if your doctor says go to the ER or call 911, then go ahead and do that. Speaking of being sick, I thought this would have gotten a bigger response. It didn't. That's fine. I'm still going to share with you my story yesterday. I've been dealing with a problem with my city. I live in the city of Philadelphia. Been dealing with a problem with tax information. When things got shut down in 2020, things got all screwed up, and that persisted for many years, and I'm still trying to fix that issue. Well, I wasn't able to log on to my account yesterday with them, and I had to call city number. I was put on hold for, how long was it? Yeah, it was like 45 minutes, or maybe it was an hour the first time. The point is, I finally get through to someone. I could hardly make out what they were saying. They were coughing. They were clearing their throat, constantly coughing again and again. They were very miserable. Clearly, they had to work while they were sick. I couldn't tell. Were they working from home? Were they working in a call center down at City Hall? I don't know. The point is, they did not sound well. Have you had to deal with anything like that? Let me know down below. Have you had to call a call center or customer service and you get someone on the line where they sound like they've lost their voice and they're constantly, excuse me, oh, apologies. Yeah, that's what I was dealing with yesterday. Oh, it was awful, but nonetheless, it never resolved my problem, and I had to call them back again to not get through. I did get my problem solved today. Well, part of it. So there's, I guess, a happy ending to a certain degree. All right, moving on. Let's take a look at the viral activity levels in Canada. COVID-19 is moderate, flu A is low, flu B not detected, and RSV is low at this time. Let's take a look at the CDC measles page real quickly. I'm going to refresh this. I don't know if it updated. The most recent update I have here was 1,596 cases, and yeah, that's what I still have. All right, so if there's any update, we'll check again tomorrow. All right, moving on now. What do we want to move on to next? Pinellas County, Florida. Taking a look at that, we do see there are some calls going on here. Not many at this time. Not terrible. Few sick person calls, just to general mixture of calls. Pretty much the normal amount is what I'm trying to say. Philadelphia, 763 EMS calls yesterday. Live looking at what's going on. That's the Philadelphia dashboard. We don't need to look at that. Live looking at what's going on with Montgomery County, where it's been very busy today. It's been north of 15 calls since, I want to say, about 11 o'clock this morning, if not earlier than that. They have 19 calls right now. I saw several ambulances when I was out, and I'm going to be out again for a few hours this evening. I'll probably see more ambulances. I'm seeing cardiac arrest. Several different things. The one ambulance I passed was for cardiac emergency. Also, take a look at this. Respiratory emergency once, 2 times, 3 times, 4 times. Yeah, that's not a good thing. Let's take a look at Chester County, Pennsylvania, and we do see respiratory difficulty showing up there 3 times. I do wonder, do we have the air quality issue? We didn't look at this. We should take a look at this, because maybe there's an air quality issue going on here. No, not. It's really good for much of the country, bad for the West Coast, and this reminds me, we need to pause and take that hydration break. Alrighty, doesn't that feel much better? Alright, continuing on now. Taking a look at Bucks County, not from yesterday, because we didn't refresh that from yesterday, but from today. 5 EMS calls right now. Taking a live look at the hospitals. Speaking of Pennsylvania, I need to check the Pennsylvania dashboard, see if there have been any seasonal updates yet. I'll probably maybe check that later this evening, and on the next data-filled update, more on that in a moment, we will let you know if there is anything. You can see here a few hospitals dealing with problems in Pennsylvania. Southeast Pennsylvania, Westchester Hospital, still dealing with some problems today. How about New Jersey? Let's see what's going on there. Hopefully, not too many problems. Cooper University Hospital, full and total divert for patient volume. Specialty issue at Inspire Medical Center, Mannington. Jefferson Washington Township Hospital, psychiatric issue. And that's it. 3 hospitals dealing with problems there today. New York State, 269 new positive tests. Taking a look at this. Yeah, they changed how the hospitalizations work. They're just showing you admissions now. And you can see here, generally statewide admissions, they dropped some on the most recent update, which was the 11th. I don't know when this is going to update. It's supposed to update weekly. It did at least change here. Maybe Tuesday is going to be the update. I don't know. 537 admissions being reported. But when we take a look at Long Island, look at this. I do want to show you. We want Long Island to come up. All right, now they're doing a zoomed out version. Yeah, it's easy to operate. You can see here, Long Island on the most recent update did increase quite a bit here. So they're bouncing around a bit. We'll have to keep our eyes on that. New York City, I'll show you that while we're at it too. New York City, yeah, that went up a little bit as well. Alrighty, let's take a look at a couple wastewater sites around the country. Since we have Harrisburg, Pennsylvania up, let's take a look at Harrisburg, Pennsylvania. COVID still listed high, but it's come way down, but it has gone up slightly once again. Norovirus is medium. That's down a little bit. I believe that was listed at high at one point. Now let's go down to somewhere in the southeast. Let's see what's going on in Alabama, shall we? Let's see, where do we want to go? Let's go to Fultondale, Alabama. And we see COVID here is low. Slight increase at this time. RSV is low, but that's starting to increase. We'll have to keep our eyes on that. Norovirus is medium at this time. Now let's go out to somewhere on the West Coast. And I'm thinking we're going to take a look at San Francisco. And what do I even have this set up for? Do we have this set up for norovirus or COVID? Let's see here. Yeah, we have it set up for COVID. So COVID is still listed high in the West Coast. It's medium in the Northeast and the Midwest. Let's take a look at what's going on in San Francisco. Then I reckon we should take a look at what is going on in Alaska, because I just saw it say Alaska, high for COVID. Here is the more eastern wastewater site. Low for COVID. Influenza A, it is being detected, as is RSV, and Influenza B, no detections for a while. That's something we have to keep an eye on, though, is Influenza A and RSV. EBD68 is high at this time. Norovirus is in the medium category, and there has been ongoing community spread of Mpox. All right, ending today in Alaska, and we will take a look at the COVID levels in Alaska. Well, just one wastewater site there, and that is Anchorage, Alaska. And if we can get that to load, let's zoom in. Maybe that'll work. There we go. In Anchorage, Alaska, yeah, COVID still listed high. Disregard the wonky movement at the end. We'll have to keep an eye on that. Everything else is fine except for norovirus at this time. There are some high detections of that. Also, oh, this is new. This is brand new. We now have detections of measles, a strong detections of measles in Alaska. I don't like seeing that, so we'll have to keep an eye on that. Thankfully, influenza A has gone back too low. Alrighty, that does it for the Tuesday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. I will see everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Tuesday afternoon. And thanks for watching.